Hello.
Oh, after seeing you.
Hello, namaste. I'm here.
Saune, Jai Shri Krishna, Jai Jirendra, Jai Swami Narayan, and good evening to you all. Hold on. So, good evening, everyone, and a very warm welcome to today's community webinar hosted by GAA London once again. We're truly delighted to see how many of you joining us for this important and meaningful session on urinary problems in women. This is a topic that affects many women at different stages of life, yet it is often not spoken about openly. Today's session is a safe and informative space where we aim to raise awareness, share practical guidance, and encourage open conversations around women's health. We're honored to have with us Dr. Marti, who brings over 15 years of experience as a gynecologist and now practices as a GP. Dr. Marti has worked extensively within the community, running specialist clinics and supporting women through a wide range of health concerns. Her experience and compassionate approach makes her especially well placed to guide her through today's discussion. During this session, we will be covering recurrent urinary infections, urinary incontinence, common problems, and how to manage them, and followed by a Q&A session. We encourage you all to listen, reflect, and if you feel comfortable, share your questions during the Q&A. So before we begin, just a quick reminder to please keep your microphones muted during the session to ensure a smooth experience for everyone. Thank you once again for joining us today, and we hope you find this session informative, empowering, and helpful. So now, without further delay, I would like to invite Umaji to begin the session. Umaji, all yours.
Namaste. Thank you very much. Sorry, I joined it after 6 only, but I thought probably you didn't see my video of the thing anyway. Sorry about that. And I'm really grateful for the opportunity. And I'm really so happy to see so many people join the meeting today. It's a very, very important topic, I know. Last time I got a feedback that I was a bit fast. This time I'm trying to be very slow. I will complete whatever I could do. I've actually concised a lot. And because, you keep having these sessions anyway, isn't it? So I thought I should not talk whatever I know about the urinary symptoms. So we'll just stick to something, okay? Let me share my screen. Yes, share. Can you see my thing? Yeah.
Yes.
Let's start from the beginning. Show me from start. Okay. Okay. As I said, I'm a GP, and as well as I'm a very passionate women's health doctor. So I see a lot of women every day. I've retired as a GP, but I still do women's health clinics in Rochdale 2 days a week. The number of women I see with these urinary symptoms is quite a significant amount, and it's a very important topic, as I said. I think probably if I can say this, how do I go about it? 1 minute. Okay, this is okay. Yes, I think I'll use my. Are you okay?
I do apologize. I've just muted that person. Please have your microphones muted. Thank you.
What I normally discuss is I always say about girl to granny gynae problems. Okay, so everything right from the child is born till the granny stage as well. So one of these, I don't say it's really granny problem. It's a problem of all women, especially women after they have children. It's a problem. Okay. This is what normally you see, like when you see when you go out, you're afraid that you have to look for a toilet all the time. And can you see that women running around for the toilet? This is very, very common. And see, she's always worried about it. And these are the things, just to show how important it's water infections are. Why am I showing this figure is, it looks like I'm talking about the anatomy. No, not really. The pelvic muscles are so important. The body is the uterus, the bladder, and the bowel all are actually controlled by the pelvic muscles. So these are the muscles. If you see, can you see, this is where the urinary passage comes out, and this is the bowel, the back passage, and all supported by this muscle, which is very thick, and it has a lot of fibers. What happens to this? When the young woman is growing up, all these muscles are quite tight. When she has a childbirth, when this is the vagina, the child comes out, all these muscles are stretched. When the muscles are stretched, so much changes happen below in the body, the bladder, and they can come down, the womb can come down. And the muscles actually, they hold the neck of the bladder. Your bladder is like a balloon, and it becomes like a small passage that is called urethra. And this is tight, very tightly controlled by the muscles. They become weak with childbirth. Another important thing is, as we get older, the muscle strength also goes, because last week some of you attended my hormones webinar or Zoom meeting, where as we get older, the estrogen disappears from our body, and the estrogen is very important for the collagen or fibers or muscle strength. So as we get older, these everything becomes loose. So that is why a lot of problems come as well. I wish I can put this a bit. This is the one. I just want to take this on the top. Yeah, that's better. If you and then the most important thing is, what are we going to discuss today? I just told you something about the anatomy, why changes happen with age. But what are the topics? One is the urinary tract infections, very, very common. A woman has recurrent UTIs, a little bit of pain passing urine, going more frequently. Sometimes they can appreciate the smell. Oh, I know it's water infection, doc. And they go and take a sample to the GP, and the GP says you have water infection, have antibiotics, 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 antibiotics. Sometimes when you use too much antibiotics, people get thrush. They get that itching in the vagina because antibiotics cause thrush. So the problem goes on and on. That is one symptom. I'm going to discuss one important thing. Another is urinary incontinence. Incontinence means the normally the bladder should women should pass, or anyone, any human being, they should pass urine only when they want to. But if they leak without their not, like for example, some women say they when they cough they leak. Some women cannot hold their bladder at all. They wet their pants. So some women are worried about it. So what they do is they wear a pad when they go out. They're worried about the accident can happen, or I can wet my dress or something like that. In comes out. When you cough or you can't hold it. We'll talk more about it. So I'm going to talk only about these two topics today. In future, when I have the opportunity, sometimes I want to do two parts for you about what are the likely cancers problems can happen in women, like uterine cancer, ovarian cancer. What are the alarming signs? When do we should worry? That time I'm going to discuss the bladder cancer. So what are the uncomplicated? So it's very, very common. They keep getting antibiotics and then goes on and all that. That is called as uncomplicated. Sometimes what is complicated, because some people keep getting the water infections, urine infections, and it doesn't disappear. It goes on and on and on. Sometimes it can go into the kidneys. Okay. And also the treatment doesn't work. Usually the antibiotics are given as before. Many years ago, they used to give trimethoprim. Now they give nitrofurantoin. I'm sure you all are very familiar with these names. They give for 3 days because that is what the advice from the NICE guidelines. The doctors don't want to use too many antibiotics, so they just give for 3 days. Some people say, oh, 3 days won't be enough for us. And then there is another antibiotic called penicillin, which is penicillin as well. So nitrofurantoin, penicillin commonly used. Normally what happens is you have a UTI, you take a sample or you have a telephone consultation with your GP, say, I think I have a UTI. Okay, I'm sending this prescription for 3 days for the antibiotics. You take 3 days antibiotics, you feel better, you drink water and you feel good. After another 2 weeks, you get another infection. Why all this happens? So this is what we're going to discuss. What are the sometimes like all women, like women have all, some of them can have a lot of problems. Okay, so what are the risk factors in UTIs? So UTIs are very common, but there are some conditions where the water infection happen again and again. For example, if they had an operation, they had a catheter, they to empty the bladder, they put in a plastic tube in the bladder, that is catheter, that can cause infections. Sometimes they may get exposed to um, organisms which are very, very powerful, that can cause a lot of problems. Sometimes people can have neurological conditions. You must have heard like multiple sclerosis, or the woman must have had a stroke or something like that. Then the bladder doesn't work properly. Or the most important is diabetes. Diabetes, if it is not well controlled, because in diabetes there is sugar in the blood, so that sugar goes into the urine. Sugar is a very good culture medium, so the infection happens frequently. how much of antibiotics the women with diabetes take, she doesn't feel better until unless her diabetes is under very good control. So whoever has diabetes in general, they have to be extra careful because diabetes attracts infections, not just water infections. It can affect any type of infections, but most commonly water infections, urinary infections. Another important thing is immunosuppression. Some people are on some immunosuppressant, like steroids. Prednisolone you people take, that is an immunosuppressant as well. Sometimes, those things can cause, some people may be on chemotherapy. Some in general have their fighting system is very poor. So all these people are more prone for water infection, urine infections, and adrenal. So, what are the other things? Bacteria, when they're present in the, for example, what happens is when you give a sample, it goes to the lab. The nurse may do a dipstick. She says, "Oh, yeah, what do they do with the dipstick?" When you give a sample, there's a stick. They put the stick on and we take out the stick and we look at it. The stick has whether you're passing any leukocytes. That means we call white cells, white blood cells. That is an infection. And it also shows whether you have any sugar, any protein, any blood, and it also shows substance called nitrites. The nitrites are positive when you have infection. All this, the stick can become very colorful. Then your GP says, "Oh, I did a dipstick. Everything, it looks like you have a water infection." Okay. So that is what. Sometimes the bacteria, asymptomatic bacteria, the two types are there. You can see the bacteria. Then what happens when the urine sample is sent to the lab, the report comes. Most common bacteria, we call it as E. coli. E. coli, okay? And not only that, the lab also gives us information that this bacteria sensitive to which antibiotic. For example, you came to see me, okay, as a GP, and I say, "Okay, Ms. Somewhere, like, anyone, Mrs. So and so, I'm giving you, Mrs. Shaw, I'm going to give you some antibiotics, and I gave you 3 doses, 3 days course of nitrofurantoin. After 3 days, I get a report that the nitrofurantoin is resistant, is not the right antibiotic. Then the GP will call the things, and also the patient herself feels, "Oh, I'm no better." So then the GP calls, "Oh, I give you an antibiotic, but your bacteria is not happy with that. So it's not, it's very happy with that. So it's still surviving very well. So we have to change the antibiotic." So they'll change the antibiotic. So that is the course happens. You have symptoms, you give the sample, and the urine dipstick, the nurse may do urine dipstick positive and gives you the antibiotics. But still, a sample is sent to the lab to check whether it is the right antibiotic. Sometimes you may have these symptoms, like you dizzy, painful, going more frequently, and all. Asymptomatic means you may not have symptoms. Okay, this usually happens in elderly people. Like, for example, they cannot. Very, very common, like in quite elderly, they're in a hospital, in nursing homes, and all that. And also, it's also common in pregnant women. Pregnant women may not have any symptoms as well, but still they can have bacteria. So that is why when a pregnant woman goes, they always check the urine sample. Okay. See, as I already is greater in the community, in the care homes. It's very, very common in care homes. What are 3 questions you always ask? Do you have any pain? Are you waking up in the night? And they say, "Look at the color, doctor. My urine has changed." The urine can become cloudy as well. Under 65 years, if any of these two are present, we send the urine for culture. Okay, these are the guidelines in general. They say under 65, even if just one of them present is, they said just do a urine dipstick. You don't send it for the culture. But these are just guidelines. But still, nurses, we do the dipstick. Nurses and doctors, we do the dipstick, and we still send it to the lab. This urine dipstick, they say, is not very reliable after the age of 65, especially if you see people in the nursing home. They're incontinent. They pass their stools, they poo, they wee, everything. They become incontinent. You must have seen, looked after elderly people in your family, and you may have friends who had problems. In those cases, the urine dipstick is not helpful at all. Okay, because there'll be a lot of contamination. So, first of all, the other important thing is we have to also rule out other symptoms. When a woman comes, we usually ask, what, like, for example, it's not all painful. When the women says, I'm passing urine and it's painful. Yes, it could be water infection, but there could be other things as well. We should ask whether you have any vaginal discharge, because sometimes a woman has a white discharge, a vaginal discharge that may make the urine cloudy. And another thing is sometimes people can have, after intercourse, there can be irritation and they can have pain as well. That also, as I discussed last time about, but I'll discuss again today because there are more number of people today. We have to discuss that. It's called urethritis. And some people, when they have any smelly discharge, they usually use washing with a Dettol Savlon. Please kindly don't do that. Don't use chemicals to wash locally. It's a very sensitive area, so you should not wash it. Another important thing is plain water itself can cause problems locally. So the more you wash, oh, it's dirty, dirty, wash, you will wash out the good bacteria, and the skin becomes very rough. So when you pass urine, it burns. When it burns, you think, oh, it could be a water infection. Okay. Sometimes the infection can be, you may not have other symptoms like, you must have noticed, you go more frequently and you have pain in the belly, but below belly button. And some people can even have temperature as well. Okay. So these are the things you have to remember. You may go frequently, you may have an irritation, but you don't have any other symptoms. You have only local irritation. Then you have to think, is it something? Probably it's not water infection. Is something going on in the vaginal area, any irritation happening there? Okay, that you should think about it. And also, sometimes sexually transmitted disease also is a part of the can cause similar symptoms. But the most important thing is genitourinary symptoms of menopause, which I'm going to discuss more. Menopause, what happens is the lining of the vagina becomes very thin. The lining of the urethra, the tube which comes out of the bladder, we call it as urethra, that also becomes very thin. When it becomes thin, it can cause more problems and you can be susceptible for more infections. So this is the urethra and this is the bladder. See, if you think the kidneys are there on the top and the two tubes will drain the urine into the bladder, and this is the urethra which comes out. So this urethral part, can become thin. So why am I getting recurrent water infections? That is what people should think. Oh, I keep getting urine infection. Why am I getting? So when somebody comes with recurrent water infections, we think whether she had the right antibiotic or not, whether the the infection has cleared out completely or not, and are there any reasons? It's not nothing to do with water infection. It could be a thrush or could be a vulval irritation. The skin where the external genitalia are there, we call it as vulval area, that can, with age, it becomes very thin. And there are some skin conditions like in sclerosis we call it, the skin conditions which can cause irritation. So people scratch. When they scratch, they damage the tissue. So when they pass urine, it can hurt. Okay. So these are the things we normally see. Any associated local symptom, that's how a doctor will look. And you yourself can think, why am I getting this? Do I have any problem with any vaginal irritation? Or is it any irritation outside? If you have any irritation outside, it's called vulval irritation. I know because you put these on the YouTube, I'm a bit particular that whether I can put some of the images or not. So that's why I'm very uncomfortable to put images. If you don't put on YouTube, I would have shared more things really. So the vulval area can cause problems. So frequent washing causes a lot of problems. That is one important. So what are the other important symptoms is, as I mentioned to you, dysuria, frequency. Dysuria means painful passing urine, frequency going more frequently, pain below the belly button, and urgency. Like if you have, someone has a water infection, they can't hold the bladder as well. They keep going again and again. Urgency, they have to go. Polyuria means passing lot amount, more amount. And hematuria is very important. Hematuria is blood in urine. Okay, blood in urine. So anytime when you see a blood in urine, it is significant. You have to see your GP immediately. Another important thing is you take a sample to the doctor, okay, and when the doctor dipstick and she finds blood in the urine, she sends that sample to the lab. The culture comes as negative. So that is called as microscopic hematuria. You may not see the urine color red, but there will be blood cells in the urine. That is what the GP, that is the reason why the GP puts a stick and check whether you have any blood. If you don't have any symptoms, if there is blood in the urine, we as doctors, we take it very serious. So we sit, is there anything going on? Is there any infection? Is there any cancer going on in the urine? So those are the things we look at it. So I'm at this stage of the recurrent UTIs, but what is recurrent water infection? If a woman has more than 2 infections in 6 months, we call it as a recurrence. If she has 3 infections, not just symptoms, sending the sample, and the sample should show some bacteria, a positive infection on the microbiology report should say, yes, you have an infection. Like that, if you have more than 2 infections 6 months or more than 3 infections in 1 year, we call it as a recurrent infection. So we want to avoid, basically, you have to be very careful, we have to correctly diagnose the condition, or else what happens is, oh, it could be water infection, come on, give an antibiotic. So over-diagnosis, and we may get unnecessary antibiotic treatment. And also sometimes we may miss something. It may not be the urine infection. It is actually a vaginal problem or something. So what problems we encounter is poor history. Some women don't give much history. And also elderly people, we have problem. And also specimen collection. When you give a sample of urine, you should give the midstream sample. So you leave the first part of the urine, and you can, if you want, if you have a sterile cup, you can collect in a cup. If you can't collect in the tube they give you, collect in the cup and you can pour it. Okay. Another important thing is you should also look at local area. Is there anything wrong? Why am I getting this pain passing urine? That is what I'm just saying. So this is what is it? The anatomy I was telling you. The womb is in the middle. In front is the bladder, and behind is the bowel. As we get older, this becomes thin. This becomes thin. This becomes thin. So what happens is, very easily, from the back passage, when you pass stools or poo, there are bacteria in that, which is called as E. coli. Okay. Because if you are young, you will take care of, not only young or old, as long as we are okay, we can take care of us. We when the people open bowels, they wipe clearly, they use the tissue properly, they use the tissue from front to the back. If like children, we used to be very careful how to wipe the bottom as well. Like that same thing happens. But as the woman gets older, she cannot manage things. She may not take care of her, very well. So the poo can contaminate the urine. And also because everything becomes very thin, the bacteria from here can easily come down. That is why women get more infections. And also women urethra is wider than men. So water infections are very common in women. The urethra is very short. Women have a short urethra and is wide. That's why women get, not like men who have a long urethra. You know that. I need not tell more about it. So another important thing is, can you see this? This is what I was telling you. The lining of the urethra is, the tube which comes out will be very thick when we are young. And because of the hormones, as the women get older, there is no estrogen. When there is no estrogen, it becomes very thin. Atrophic vagina. When the vagina is very thin, atrophic urethra. Even the urethra is very thin. So when the urethra is very thin, you can catch infections easily. So that is the cause for the high incidence of people getting water infection. What do we do? So using local estrogen, I mentioned last time, there are estrogen tablets are there, estrogen creams are there. Most of the women can use. The only contraindication is when the woman has breast cancer. Okay, even if the woman has breast cancer, sometimes I give lubricants to them so that the moisturizer is maintained very well, the vagina is maintained well, the urethra is maintained very well. So that is the okay. So almost there is what happened is in there'll be significant when you get a water infection, you are menopausal, your GP should be able to provide you some vaginal estrogen. Or you can ask yourself, do you think it's because of lack of estrogen I'm getting these water infections? Some GPs may not think about the giving you estrogen because all may not be interested in women's health, or they may not, or they're too busy or something. You yourself should think, why am I getting water infection? So then you can ask your GP, can I have any local estrogen? Am I suitable for to have estrogen? Can I use the estrogen to prevent water infection? Then what happens is, so let me tell you, this is what we did in our surgery. We had about people like, many what, so there were 28 patients, okay, in the Castleton. We did this small study, like they keep asking for a water infection, antibiotics. So what we did is we did a telephone consultation. We looked at their notes. And when the women had a water infection and she had another infection, we called them all and we gave them estrogen. We gave them all estrogen, local estrogen therapy. Then out of that, 23 of them were so happy. They did not have any recurrence at all. Okay. But some 3 women found no change. In that case, what happened is there are other reasons why the women gets water infection. Sometimes the women urethra, the passage will be very narrow. She cannot empty properly. So it's like a drainage, and when there's a drain is going freely, okay, you won't have any problem. But the drainage is narrow. When it becomes narrow, she cannot pass urine. So we call it as voiding problems. That means she's not able to empty properly. If a woman thinks that before my flow was very good, when I pass urine, I pass urine normally, but I'm passing only small amounts, then she should mention to the doctor, is there a problem in the passage? So that is what happened. And we actually, the next step we do is when the woman is getting water infections, we usually ask for a scan, whether she's emptying her bladder properly or not. If the woman is not emptying bladder properly, that she's at risk of water infections. So general advice is, in general, vulval hygiene is very important. Vulval means the area, what in front, the external, the genitalia area of women is called vulva. Not to use any irritants, like a Savlon, Dettol or anything. Use a barrier cream. There are excellent creams are there. You can ask your GP or you can buy over the counter. It's called Dermol or Double Base or something, or moisturizer. If you put the moisturizer, what happens in some religious things, they have to wash their everything before they do the prayers. So they are at high risk of water infection. So what we do is we give them these creams. When they put the cream, what happens is the urine, when they pass the urine, it doesn't damage it. So, or if they wash also, imagine you apply oil on an area, you put water, the water doesn't stay there, it just slips. So oil type of thing is like a barrier method. So that is why we use creams so that the water doesn't stay there. Recurrent use of water, washing all the time is no good at all. You should not. Baths are the worst after certain age. Baths cause damage to the skin there, and they end up in water infections and all problem, vulval irritation, vaginal irritation, all that happens. Okay. And also it could be, sometimes it could be thrush. So if you have a thrush, itching and everything, then also when you pass urine, there'll be burning sensation. So you should mention to the doctor, doctor, I'm having burning sensation, but I'm having itching as well. If you don't mention that, the doctor will give you antibiotics without even seeing you over the telephone. You take the antibiotics, the thrush gets worse and you won't get better. So if you have any associated itching there, you should mention to the doctor. And as I already said, good control of diabetes is very important. And again, the last and most important is frequent washing and baths to encourage. We always encourage having a shower rather than a bath. So I don't know how we are doing with the time. I can stop here and take the questions. We can do incontinence on another day because I've been very happy to complete only recurrent water infections now. You can tell me that. And one more thing before we go, just how I said the menopause can, the thinning of the thing happens. We also look at, as I already said, do you have any poor flow or any gynec operations you had? Or do you have a prolapse? Oh, that's a very common thing as well in women. What happens with women is as they get older, the first picture I showed you is the muscles. When the muscle becomes very weak, the bladder comes down. That is prolapse. We call it a cystocele. And we have to rule out any prolapse. That is very, very important. When the bladder comes out, they cannot pass urine. Some of them have to push the bladder inside. Okay, prolapse is by itself is a very big topic, and I love to talk to you about it because many women suffer with prolapse as well. But I have to show pictures on the screen to you. I don't know whether I can, whether it will be censored or something like that. But I have to show you. I have pictures. What do we do when a woman has a prolapse? As a gynecologist, we push it and we have rings or something, we put it inside. There are different types of rings are there which we stop the prolapse. Okay. And another important thing, as I already told you, when the water infection is not getting better, recurrent water infection, we usually ask for a scan. The scan, what the scan do is, first they do a scan for you with a full bladder, okay? And they'll ask you to empty the bladder and do the scan again. Normally, you should empty the bladder completely, or there could be some urine. But if the urine is more than 100 ml, that means you're not emptying properly. That is the voiding problem. Okay. So these are the things you have to remember before we go to the incontinence, which is a very big topic. I am very happy to stop here and take questions. Thank you very much.
Amiji has a question.
Mhm.
Amiji?
Yeah, hi. Thank you for hosting this incredibly important seminar. I am a kidney donor, and
Uh-huh.
I'm also a volunteer for kidney transplant to help other families. I do get calls, and the recipient sometimes develop a kidney infection,
Mhm, mhm,
the recipient who has one kidney.
mhm.
And what happens is, um, what is the reason why they keep getting this urine? Is it because they are on the medication all the time, on lifelong medication for anti-rejection and all the other ones, including steroid? So is it because of that?
Yeah, I first of all, I congratulate for your generosity, just doing that thing about the kidney donor thing. And then because most of these people who have any
Sorry.
transplant, when they do any transplants, there will be a high amount of medications called immunosuppressants. So when they immunosuppressants, they're at risk of infections. Very frequently, they are at risk of infection. But another important thing is if she is a woman who is actually having an immunosuppressant at all, there is no contraindication for her to use estrogen therapy. Estrogen actually, local estrogen tablets or cream make the vagina and the urethra very strong, so that, imagine there is a single layer, the bacteria can go easily. If it is a thick layer, the bacteria cannot penetrate. So that's what the estrogen do. So I think I answered the question. You have answered your question yourself, that immunosuppressants are cause. Yeah. Okay. Thank you.
Thank you, Amiji. There's Niruji. Hello, Niruji. Niru, are you there?
Please feel free to ask me any question on water infections or anything, because I'm a GP, I'm a gynecologist as well. So I'll be able to, hopefully, I'll be able to answer your questions.
So while we're waiting, I can actually ask on behalf of the participants, how common are urinary problems in women? Should we start paying attention to it at early stage or at a certain time?
Yes, I have to say they're very, very common. I can't give you exactly the percentage, but if I, depending on the age, that's why I'm not able to give you the percentage. Okay. For
Okay.
postmenopausal, there's a difference in 50-year-old women. About if 50, if I see 20% of women around 50 years, around the 50 age group, 50 to 60 come, but by they come to 70, it goes to 30 to 40. 80-year-old, they're much more common. So as the age advances, so that is why we can prevent it ourselves by taking, that vaginal health is equally important. How we look after our face, our wrinkles and everything. Surprisingly, when we get older, we get wrinkles on the face. But vagina, if you have seen the picture I showed you last time, vagina normally has wrinkles inside. In a young woman, those wrinkles will disappear and it becomes very thin. So vulval health, vaginal health, very important for women to have a good quality of life.
Yeah. There's a question there. If you have incontinence, can you have an operation to stop that?
Yes. Incontinence itself is a big topic, as I already said to you. Okay. I have a feeling that it's too much for everyone to take today. Okay. I'm just concentrating on the recurrent water infections. Okay. The incontinence, there are two types of incontinence are there: stress incontinence and urge incontinence. Okay. I'll be very happy to discuss in detail. There are operations for stress incontinence. Okay. And urge incontinence stress incontinence means they leak when they cough. There are wonderful operations are there. And urge incontinence is they cannot hold their bladder. They are managed, their wonderful medications are there for that.
Okay. So there's another question saying, my urine is very, very pale, properly like normal water. Is it dysuria? Should I get checked out?
Dysuria is a painful when you pass urine. If it is pain, we call it as dysuria or dysuria, whatever you said. But normal, when it is very light, you can take the sample. That means probably you're drinking too much. Like when people drink too much, the urine will be like water. Okay. And
Okay.
sometimes when it is the water is when you're passing large amounts, more amounts of water. For example, oh my God, I just emptied my bladder. I passed almost like a liter. After half an hour, you pass another liter. We call it as polyuria. Then you should go and see the doctor. Take your urine sample. They will send it to the lab if there are any other conditions like that. But I don't think that it is infection. But it is, if you're worried, you can do that. Probably you're keeping yourself very healthy, and that is why it's pain. That's why.
Yes. Yes. There's another question saying, are there any exercises to help bladder issues?
Definitely, there are loads of exercise which I can discuss, but as I said, it comes under incontinence. They're pelvic floor exercises, and they have shown excellent outcome with these exercises. I can really tell you how to do these pelvic exercises, which is very important. The exercises are not, you have to do like sincerely, like how you take the tablet 3 times a day. It is actually tightening the pelvic muscles. And that, for example, if you carry a weight, if you lift your grandchild, you should tighten your muscle before you lift your grandchild. When you do these exercises, automatically, Tesco bag or bag, something, you want to carry a luggage or something, you first tighten your muscles with these exercises. I'm sure definitely I'll be happy to do that for you. A big session. That's a big session. I got a when I did my first presentation, I have to say I was over enthusiastic to tell you everything. But I also realized, because I'm used to talking to medical people,
Yeah,
okay, but I've realized that I have to slow down, and I have to realize the audience are all the non-medical people. So I don't want to give too much at the same time.
absolutely. There's another one saying, can you please do a session on vaginal prolapse?
I'll be more than happy, but the only problem is I have to show you the pictures, how they look. They can look deadly as well. But you record them. I don't know what. I can actually bring my gadgets, okay?
Okay.
What I use. I have a box full of things what I use for prolapse.
Okay.
Uh,
So
so
what we can
incontinence.
so what we can do next time, we won't record for
Yes,
people,
yeah.
so you can actually show it to us by picture. So there's another question there. What do you get? No, where do you get a private operation for stress incontinence?
You have to go through your GP, before you go for the operation. First of all, using estrogen. Simple things I'm telling you for incontinence is reducing caffeine. That
Mm,
is why, I have beautiful slides, beautiful presentation. I'm already prepared for it, to show you. Just changing your drinking habits is enough to prevent, to help you with the incontinence problem. Caffeine, fizzy drinks,
mm.
all this diet coke, they all cause problems. They irritate the bladder. Okay. And first of all, you should see that trying exercises, using estrogen, looking at how much you drink, decaffeinated. Because if you are already diagnosed and they say you have need an operation, you have to just go through your GP. Oh, there will be, like, if you have to just pay, anyone will do operate on you, but if it's a private operation. But before you jump and have the operation, you should try all this first.
Question: is it good to take medicine to make sure you empty your bladder fully?
Okay. We don't give tablets to empty your bladder fully, because first of all we have to find out why that patient is not able to empty. If she has a prolapse, she can't empty. Okay.
Mm,
In simple advice I give for women. Okay. This is again, when a woman sits on the commode and passes urine, if she thinks she's not able, she has a bit of prolapse, that means something coming out, she should stand up for 2 minutes and sit again. Then she passes more urine. Okay. So the exercises, the prolapse is the one of the cause. We're not, there are no tablets as such, but there are tablets to help incontinence. You urge incontinence, and even stress also there are tablets.
okay. So where the vaginal wall, etc., has become thin,
Yeah.
what precautions should we take to prevent infections?
Okay. The first and foremost is, one is, vagina is thin, you have to use vaginal estrogen. Please feel free to ask your GP to prescribe you vaginal estrogen. Okay, because it makes the thing. Normally, the vaginal estrogen is given as every day for about 1 to 2 weeks, and then after that, twice weekly, forever and ever. And it also helps for normal sexual function, which I mentioned last time as well.
Mm,
So vagina should be that. And the second thing, too much washing is no good. Okay. Why? Shower is better than sitting in the bath. As I said, water makes it worse. Water actually causes all these problems. Okay. So those are the things you have to read. And the third is, if you have any the bowel movements, you avoid constipation as well. So sometimes, people have problem with the constipation, or they have loose stools as well. They have to address that. Why am I having diarrhea? Because the stools are loose, the bacteria from the back can come to the front.
mm, yeah. Another question. Why am I, no, why am I think she meant to say, why am I getting smell and irritation? I am 86 years old woman with mastectomy at 20 years ago.
With the
Why am I getting smell and irritations?
Mastectomy. Oh, right. Okay. So,
Mastectomy.
yeah, mastectomy means she must have had a breast cancer.
That's
That
right.
is why she had it. So, there is smell and irritation that can happen because the vagina is very dry, everything. So, if the normally we can't give estrogen for women who had breast cancer until unless the like the hospital in breast cancer there'll be types, if they are still under the care of the surgeons, then they can ask, can I have my estrogen? But someone who had operation long time ago, they will be discharged. Okay, they can ask the GP whether they can use a small dose of estrogen. Some GPs will be happy to give, or instead of estrogen, they can use lubricants.
Hmm.
The water soluble lubricants are there. So when because it's the lubricants, they keep the area moisturized and there'll be less damage, because it's a thin vagina and everything.
Hmm.
Another important thing is if there is smell, if the woman is diabetic, we have to know that she is the diabetes under control. Because if the diabetes is not under control, they get vaginal infections, vaginal smell, and all that. Okay, so
Hmm.
that is important.
Another one. Please advise that uncomplicated urine infection for 16 between 16
Yeah,
to
yeah.
64-year-olds can be treated by pharmacists.
Yeah, usually nowadays what is happening is some pharmacists they say that if you have any UTI, they can give a short course of it. In different areas give different things, Most of the in our area the pharmacists don't give, the only the GPs give a 3-day course of the treatment. Nurse will give like that. Okay. So if it is uncomplicated, but one thing we have to remember, if one infection you got and the pharmacist is giving is okay, but you're getting again and again, we should address it.
Hmm.
Taking too many antibiotics is no good. We
No
all
good.
agree
Yeah.
with that, you know.
Yeah.
But
Yeah.
why am I getting water infections again and again? So that one is, as I said, you should drink plenty of water to wash away nice things, taking good hydration. Second is, if you have diabetes, good control of diabetes. Third is estrogen therapy.
Hmm. My mom is 85 years old, done blood work. Doctors say you have to see or and visit kidney doctor.
Okay. The problem is the kidney problems are different problems. For example, we call it as EGFR, how efficiently the kidney is working. So with the age, our EGFR will go down. Okay. If the EGFR, the kidney function test, the blood test must have shown that they may be having a high creatinine or low function. The function is low, then they have to see a kidney doctor. Okay. Because as we all get older, our kidney function will go down. Okay.
Yes.
Yeah. So that is why a good control, if you have hypertension, a good control of hypertension, taking care of ourselves is very important. Up to the age of 40, okay, the body looks after you. After 40, we have to look after the body. So if someone has a blood pressure, it's very common. We have to make sure the blood pressure is under control and well maintained. You take your medication regularly. If you don't control properly, then you end up with kidney problems. Or you have to. Doctor says don't eat too much sugar or too much salt. Of course, we have to keep it balanced and make sure. So it is common. Yeah, the kidney function is a totally different. It's a medical thing. As a GP, I can say that the kidney function is low. They have to see a nephrologist.
I think this is very interesting. I have MS and I'm 60 years old. I have incontinence, but not too bad. I cannot leave home without going to the toilet first. I have had uterus every 6 months. I am on HRT patches. I had a hysterectomy about 10 years ago. What can I do to help myself as I have lost my appetite and struggle to drink water due to my incontinence?
Okay. This is a very important question.
Yeah.
I really appreciate that whoever has presented it, they're sharing their problem. Okay, this is what I want in these meetings. Feel free to talk.
Yes.
What the MS can cause bladder problems, but someone who had because women of 60-year-old, what happens? Even though you take a patch for your HRT, it doesn't work on the vagina. It doesn't work on the vagina So if you have a problem like that, first of all, why are you getting recurrent water infections? You should have a vaginal estrogen, okay, which actually strengthens it. And second important thing is someone should assist your pelvic muscles. If your pelvic muscles are lax, you should do some contractions. Basic. I don't know how degree of problem you have with MS, but see, they go for Pilates, yoga, and all those. Those are the things which actually help the core muscles. What do they say? This core strength. That is what they have to do. But in her case, definitely she needs vaginal estrogen. She should go and see her doctor and ask for vaginal estrogen. Okay, it helps. And sometimes if the doctor will ask some questions, what type of incontinence is, which we are going to do in the next topic in future, then the doctor will decide. They can give tablets to control that. If she has a tablet, she can happily go.
Yes. Before I go to the next question, Tanaji has a question from LA. Tanaji, unmute. Thank you.
Anyhow, I'm talking on behalf of my wife sitting next to me.
Uh-huh.
She's 79 years old. And she has a lot of itching in the vaginal.
Uh-huh.
Not control her urine at all. She has to rush when we go out and come on the home, open the door, and she has to run.
Mm-hmm.
I don't know how to cure all these important things.
Okay. So I want to ask that, for her, definitely she needs to see a good gynae doctor who have to examine the vaginal walls. Okay. And can I ask, is there any history of diabetes?
Yes.
She's on the border.
Okay. So when there is diabetes, what happens is women get a lot of fungal infections. We call it as thrush. Okay. So that can cause itching, severe itching. So it's nothing. The doctors can easily give you a pessary or something to treat it, like for the thrush. The second most important is she would also definitely benefit from estrogen therapy. One thing you have to remember is if you have a fungal infection, the itching is there. First, you need to treat that before using the estrogen therapy. And in her case, if there is thrush, treat that. Someone should really examine her. And is there any other reason why she's having that? What about her vaginal health? How is the vaginal walls? Is it very thin? So whether she needs vaginal estrogen. And the third, whether she needs some exercises to control the bladder. So as I said, there are two types of incontinence. One type of incontinence, exercises will help. And the other type of incontinence, there are tablets for that. So it can be treatable easily. These are the patients I see here in a day-to-day life. Yeah.
The therapy will help?
100%, 100%. It is nothing to worry about. You just need to see a gynae doctor and they will do a speculum examination and they may take a swab. If they say you have a fungal infection, they treat the fungal infection and you should ask for estrogen, vaginal estrogen. If someone had problems with the breast in the past, especially breast cancer, that is the only contraindication. You can happily, all women should use vaginal estrogen. To help for the bladder. Okay, thank you.
Really appreciate it. Thank you very much.
Sure.
Thank you. Another question. Also, if bladder incontinence pessary is not working for you and you do not want to take medications, what are other options?
Okay, it depends what type of prolapse you have. That is the percentages. Okay, there are so many types of pessaries are there. If the incontinent pessary, there's so many types. So in the pessary class presentation, I can show you a lot of pessaries are there. Okay, so if the bladder incontinence pessary is not working, so we have, as I said, if it is you're not able to control, there are tablets to stop it as well. If it's an urgent incontinence, if it is due to prolapse, then you need a pessary. Okay, and the pessaries are different types are there as well. So which will definitely help, And you don't want to take any medication. Exercises, pelvic floor exercises help as well. You have to do proper. You can just Google and see pelvic floor exercises. Every woman I'm speaking today can Google and see what are pelvic floor exercises. They should keep doing that exercises. They're fast exercises and slow exercises. And the YouTube is so good. You have everything there, how to do the exercises.
There's another question there. Is there any side effects for having an operation? I think she meant after having an operation.
Yeah, it depends upon what type of operation. There are operation. People don't do the operation until unless it's really needed. So first they treat the prolapse or whatever, they do the exercises first and they try everything and then they do the operation. If the operation is the only choice, then you have to go for it because it will be decided by a gynecologist. And usually what are the complications, which they will discuss what are the nothing is without a side effect, but we have to weigh the pros and cons, what happens, isn't it? And you naturally, every doctor, I have to say, hand on my heart, they want to do the best for the patient. So I don't think, like staying in a hospital for 3 days, you have to follow their advice, you'll be fine.
There's another one. What is vaginal prolapse? Can you please explain the symptoms, etc., etc.? Thank you.
Vaginal prolapse is not, vagina is like a tube, okay, which is used for the sexual purpose. But the prolapse is what happens is the uterus can come down. The uterus should stay on the top, okay, but the uterus can come down. If you just, can I show the picture? 1 minute, I'll show the picture. Share, I'll show you my thing. Yeah, see, can you see that? All this I wanted to see. For example, can you see this picture? Okay.
Yeah.
Normally, the womb, it should stay in the top. Can you see here the bladder is coming down? So the woman will see a bulge in the vagina there. It looks like a bulge. Okay.
Yeah.
So the prolapse can be prolapse of the bladder. It could be prolapse of the uterus, or it could be prolapse of the blood of the bowel. So the front, if it is front, we call it as a cystocele. If it is a uterine prolapse, we call it uterine prolapse. And behind, we call it as a rectocele, bowel prolapse. So it depends upon what the prolapse is like. Okay?
Yeah.
Okay?
Okay. There's another question there.
Okay, let me find out, innit? Let me find out.
Hello.
Hey, can you just hold for 1 minute? I'm getting some urgent call. Normally, I don't.
Okay. Okay.
Somebody has got unmuted themselves talking. Pannaben, can you?
I've done that. I have.
Thank you.
I have. So while we're waiting for the doctor to answer her question, what do you? Oh, she's back. Okay. So there's another question saying, does cranberry juice help with the prevention of bladder problems?
Yeah, there are some studies, they say, but now they say they're not much. So there are pros, people say for it and avoid. Basically, drinking plenty of water will help to clear it as well, There is some evidence in the past cranberry, but you have to be very careful because whether there are any interaction. Some people will have any heartburn and all, cranberry juice can make it worse. Those are the things. But drinking water, but even if you drink cranberry juice, you may dilute it much and drink it as water. Yeah.
Is it possible for you to give the name for the vaginal estrogen? Name of the cream?
Yeah. Vaginal estrogen is called as estriol cream. When you ask your GP, they will definitely give you. It's called estriol cream. It's a 0.1% cream, 0.01% cream. And there are so many preparations. Are there vaginal tablets are there? Vaginal tablets also, estrogen tablets work very well. It's called Vagifem or Vagirex, and Bliss is a pessary. So there are about 10 to 12 varieties are there. It's your choice, and your GP can give you anything. They're all prescribable, very easy. Your GP can have. You should ask them, can I have the estrogen, please, for my vagina? Because sometimes, unless you ask, the GPs won't do that as well.
Yeah.
Because all GPs may not be very much interested in women's health as well. Nothing like that, because I'm not good in asthma like that. Okay.
Right. Okay. So there's another one. If one is taking.
Sorry, I can see in the questions. 100%. Your estrogen patches don't work for vagina. You need vaginal cream or vaginal tablets for vagina.
And going,
Sorry, same thing. If you use vaginal tablets, when you use the vaginal tablets, it doesn't work for hot flushes. It doesn't work. They both are different. Yeah.
okay. So going for urine often, I drink water since mouth is dry. Why? Oh, plus daily using pad or diapers, cannot control urine, and she is 76 years old. History of 10 hours, suffered bleeding problem. Now
Yes,
hysterectomy done.
so probably she had a hysterectomy 10 years ago because of the problem. So again, that because it depends on what other tablets you're taking. Okay, if the woman is already taking some anticholinergic, for example, simple codeine, or you be taking tablets like amitriptyline, some of the tablets they cause dry mouth. Okay, so that is very important. So
Not taking any tablets, no.
okay, very good. So are you like any history of diabetes?
No diabetes.
Very good, very good. So then the best thing is, because if you feel the mouth is dry, they have to do some tests. Why you're feeling so dry mouth? Okay. First of all, we have to see what is the cause of the dry mouth. And another important thing, again, as I already said, the muscles become very lax as we get older. So you need an assessment. Either the GP may assess you, and definitely vaginal estrogen and exercises will help. Okay. And you also look at what are the drinks you're taking, how much cups of tea, coffee, any fizzy drinks, all
Two
that.
and a half, 2.5 cups of tea. That's it. In the morning and in the afternoon. That's it.
Okay. And it will not only the cups, it depends upon the amount. Small cups are advisable. After the age of 50, I prefer women to have a small cup. The whole day, instead of the whole day, it should be only one mug. You can drink 3 times. You should see
That's
that.
my oxygen. Without chai, I can't live.
No, that is what I'm saying is, see, I may drink this. I don't know whether you can see me.
It's smaller than that.
No, not even this. I may drink this much in the morning, this another in the afternoon, and all. See the difference. After 6 o'clock in the evening, you should not drink any tea or coffee, because you will keep waking
No,
up.
no, I don't drink after 6 o'clock now. 4
Like
o'clock, I drink, and in the morning, that's it.
lifestyle management is very important. So some people say they take only 2 cups of thing. I asked my patient to bring. She brought this mug.
2 cups.
She was drinking 2.5 mugs of tea. You believe me, I should have recorded her message. Once we reduced it, she's a happy woman.
Okay.
Okay, that is very important. And also vaginal estrogen is very important as well. Any age you can use vaginal estrogen. Okay, very important.
Okay. Thank you very much. Thanks a lot. Happy
Thank
Ramnavami.
you. Happy Ramnami. There is Simon. Simon, are you available?
I am. Thank you. Thank you. Wonderful seminar. Absolutely marvelous information. Our esteemed speaker was talking about shower rather than bath. When I was a young woman, I suffered with terrible repeated urinary tract infections from sitting in the bath with shampoo and bath salts and things, and they were irritating the urethra, and I'm sure that was a cause. But I use the vaginal cream, the estrogen cream, and I found it absolutely wonderful. But it was only when I started applying it, so it goes in with a like an applicator. But then I started applying a little bit to the entrance to my urethra, and that was when the stress incontinence seemed to resolve. So I wonder whether that wasn't in the instructions. I came up with that idea myself. Is that something that's nowadays recommended, or is that not something that would be a good idea?
Excellent. You have done a wonderful job, really. When you put the whole thing, they expect that it will go up to, it will be a little bit, will be thing with the urethra as well, because they're very close. Vagina and urethra very, very close. So usually using a vaginal estrogen will actually help the urethra as well. But as you said, if there is a urethral problem, some people cannot use the introducer, when they get old with the arthritis. I usually ask them to take a finger and smear it, and including the whole of the vagina and into the urethra. It will help definitely.
Lovely. Thank you so much. Wonderful information this evening. Thank you so much.
And I have to thank you because you are so good. You shared your experience. Now people will believe you rather than me. So thank you for that.
There's another question. First, thyroid full blood test with T3 and immunity will make a difference. Immunity has to be good, and gut, it will make lots of difference.
I didn't understand the question properly.
Yeah.
First, thyroid full test with T3. Yeah, I'll be very happy if the person is there and want to talk.
Shobana, are you there?
I'm here.
Go on.
I had a problem. That was my problem. I'm getting too much UTI infection and all that.
Uh-huh.
And down here, the GP don't do the T3 check at all. So they don't know. So you're not getting a thyroid. They do thyroid test, but you're not getting a proper amount of thyroid. Mine was only, they were prescribing all these years for 13 years, 75 or 50.
Okay.
Recently, I was in India and I got the blood test check, and they increased my thyroid medication. And that was the thing I ever did. It made a lot of difference.
Okay.
From 75 to 88.
Okay.
So if you don't have proper medication, because that does not, it does not, because then your immunity is not working proper.
Yes.
Because I know my immunity wasn't working, but the doctor wasn't paying any attention. So if your thyroid is not right, medication, your immunity is not good.
Yeah.
So you must get immunity check properly, and your guts to make sure everything's okay.
Yeah, that's
and
true.
the other thing, I started another protein powder, and that's the other thing made a difference also in my life.
Very good. Very good.
And in a short time, in the 6 months.
Okay, good. Yeah, that's good. You are sharing that thing, it will help others as well. Thank you.
But I had it for a long time. I was tired, doing exercise, nothing seems to be working. But I think if your immunity is not right, doesn't matter what you do, it's not going to work. It's not going to work.
You'll catch infections very easily, That's
it will not work.
Yeah,
and vitamin D3 with K2.
Very important.
And the magnesium.
Yeah.
And the vitamin D, you can take any amount, okay? It does not have a side effect. And if you're not taking it proper, that will cause a lot of problem. You'll catch everybody, whatever they have around you.
Yeah. So, immunity is very important.
Yeah.
Thank you. There's a last question now. I am 76 years old. I have a problem where my bladder is very weak and have to go to the toilet many times. I have the problem where I often leak in my clothes. Any advice?
This is the next topic. I'm telling you. This is a vast topic. And it is a very, very interesting topic. And it's a lot to talk about it. Unfortunately, as I said, after my experience from last week, I want to do only bits.
Bits, yeah. So, one more last question. What does T4 mean?
It's a thyroxine.
Oh, thyroxine. Okay.
So the measure, what, 10.3, does that mean it's less, or what is that for?
It depends upon the range of the lab, what the lab says, like every lab has a range. So some lab have a range like from 9 to 14, like that. It depends upon what lab and what your local lab is. Depending on that, if it comes within that range, then it is normal.
Or you can Google it, what's the normal range of your thyroid and everything.
And it depends on your lab as well, where it is from.
I'm not sure, because as long as your the blood test is right, because the blood test is like you have to have a certain point, okay? So it tells you, are you okay? Are you in that range, or are you out of the range?
Yeah.
If you Google it, it's good for you.
Okay, thank you.
But that's the medical NHS and WebMD.
Thank you. This is for a younger woman. Can UTI be linked to lifestyle or hygiene habits?
Exactly. This is what isn't it? Because UTI is linked with this. As I said,
Yeah.
people very conscious. They wipe, they clean too much, and they irritate. They may not be an infection. Is local irritation can cause all those symptoms. Okay,
Mm.
and then that is very very important. And the lifestyle is a good diabetic weight, maintaining normal BMI, and also not no history of diabetes. I know eating healthy, drinking plenty, keeping your muscles all very pelvic muscles good, all that will help definitely. And a good bowel habit as well. People having constipation can have recurrent water infections, so the lifestyle is very very important. The diet is important, exercise is important.
So, what can we do early in life to prevent future urinary problem?
The main thing is, basically with the lifestyle, maintaining your body mass index so that you don't get diabetes. Naturally, we as Asians, we all are prone for diabetes. So once we have the increase the thing, about the diet wise, as which is asking, especially avoiding takeaways. Okay,
Mm.
and eating home cooked food, a balanced diet, no fizzy drinks at all, no fizzy drinks at all. And of course occasionally you go for a party, you can have a drink or something, but not like a fizzy drink. It's not a regular. Many of the patients, when they drink too much fizzy drinks, they put on calories, and that they put on weight as well. And if you can avoid sugar in your tea and coffee, that will help you a lot right from a younger age. If you avoid sugar in your tea and coffee, and no fizzy drinks or occasional fizzy drinks, and people who smoke should give up smoking, and then and maintaining a good body weight, BMI, so that definitely will help. I'm
So,
sure you had a guest lectures on the healthy living, So
yeah.
and there is another doctor. If you want any more, I can ask the doctor to do that for you.
How can women overcome embarrassment and seek help confidently?
This is the purpose of my presentation. Okay.
Absolutely.
Nobody can take care of you.
Yeah.
I have to take care of myself. There's no one who can take care of me. Okay. Especially vulval health or vaginal health or anything. When you're free in this country, you can openly talk to your doctor very well. If you're not happy to see a male doctor, just go and see a female nurse or a female doctor. I know it takes a long time. That is my purpose of doing this is presentation is please be open and talk about it.
You've just answered my question, which was going to be my last one, saying if there is one key message you would like every woman to take away today, what would it be? You just answered that.
However, your general health is important, vaginal health is important,
Yeah.
and vulval health is important. The women as then only it's a holistic approach.
Absolutely. Thank you very much, Umaji. That was wonderful session we've had. As we come to the end of today's session, I would like to take a moment to sincerely thank Umaji for sharing her valuable time, knowledge, and practical guidance with us. Today's discussion has been incredibly insightful, helping us better understand urinary health, recognize common symptoms, and most importantly, feel more confident in seeking help when needed. It's a topic that is often not spoken about, but as we've seen today, awareness is the first step towards better health and well being. So, on behalf of GAA London, I would like to also thank each and every one of you for joining us this evening, for your engagement, and for your thoughtful questions. We
Thank you very
truly hope
much.
we truly hope that you found this session helpful, informative, and empowering, and that you will take these learnings forward, not just for yourself, but also by sharing them with your family and friends.
Thank you. Thank you very much.
Thank you.
Thank you.
Jai Shri Krishna.
I wish you would let me finish off and then say Jai Shri Krishna. Thank you very much to you. Please do keep an eye out for our upcoming community webinars where we continue to bring relevant and many meaningful, helpful health topics to you. Until then, stay healthy, stay informed, and take good
Thank
care
you.
of yourselves and your loved ones. Thank you once again, and look out for the links for our next topic with Umaji. Thank you again. Take care. Good
Thank
night.
you.
Shubharatri.
Marti, thank you very
Good
much.
night. Thank you.
Good night.
Thank
Okay.
you. Thank
Good
you so
night,
much.
all. Thank you all. Take care.
Thank
Can
you, Panabin.
Sorry,
can you
I
send
said thank you, Panabin.
you're welcome.
Thank you.
Bolo, Tannaji, bolo.
can you send us the details every time on the phone to me so I can join with my wife?
Oh, sure. Do you want to send me a message so I can add you in? I don't have your number.
It's nine. Can I give you? It's 909-524-88.
No, I'll give you my number because I'm busy doing something else. So, yeah.
Right.
So it's 07958 237 302.
07958-237-302.
Yeah.
Thank you very much. I really appreciate it. And what's your,
It's +44. Yeah.
Please. Can
I
you
know.
repeat your phone number, please?
What's your name?
Panna.
Anna. Okay, thank you very much. My sister is sending from
Your
London.
phone number, please.
It's 07958
07958
237
237
302.
302. Shall I send you the phone number, my phone number? So
Yes,
that you can.
please. So I'll add you into our webinar group. Okay?
Thank you.
Okay.
So when
Thank
shall
you.
I ring you back?
Sorry?
When can I see ring you? You will be free. What time?
Send me a text message. Where are you based?
Seven Kings, Ilford.
Oh, Ilford. Yeah. You can ring me in half an hour.
Okay. Thank
All right.
you.
Thank
Bye.
you. Thank
Bye.
you all, and good night. Shubharatri to you all. Thank you. Bye.
Shubharatri.